Good morning, everyone, and welcome to episode 3 of Add Water and Stir. Cheers. This morning is National Raspberries and Cream Day, so that is what we will be enjoying fresh from Sprouts Market here in Westlake Village. Let's see how they are. Pretty good. Pretty good.
Excellent. I didn't know it was National Raspberry Day.
That's pretty exciting. I do love raspberries.
Yeah, so so do the people in the Bronx when the Yankees are doing bad.
So this morning we are going to be talking about appliance selection. So with no further ado, Dr. G, take it away.
Well, again, good morning. We're broadcasting to you from beautiful Westlake Village, California. It's early morning, Friday. What's the date? August 7th.
August 7th.
August 7th. Beautiful sky. We can still see the moon up above. Been having just a nice time actually with the restrictions. Yesterday morning, got to go down to Zuma Beach in Malibu with my wife and the dog, and we got a good 4-mile walk in at low tide, and we met some very nice people. Of course, we kept our distances and we had our masks on, so I encourage everybody to follow the guidelines that are set forth by the officials and stay safe, okay?
Absolutely.
You don't want to fool around. I get asked all the time by clients and prospective clients for mentoring in their sleep apnea program, dentists we're talking about, what's the best appliance to use? What's the best device for snoring and sleep apnea? Well, at last I checked, there were more than 300 different laboratories producing devices with varying characteristics, all of them claiming that theirs was the best possible device. I studied for the boards from the American Board of Dental Sleep Medicine a number of years ago, and I still follow the literature even today, and I can tell you that there are no studies which would select one appliance over another. So the real question is, what is the problem that you're trying to solve? Okay, so if you're a dentist, you may think or want to know, well, for veneers, should I use Emax or should I be using feldspathic? Well, again, it depends. It depends on a number of factors. It depends on your patient's demands. It depends on how much reduction and alteration of the underlying structure you plan to do. So these are some of the factors that one needs to take into account and decide, well, what are the problems? What are the main problems that I'm trying to solve? And now that we can apply that to dental sleep medicine. One thing I would recommend is try various appliances, okay? I mean, I've tried probably 5 of them. From one of the first ones I had, which was the UCLA modified Herbster called the Clark appliance. Nicole will take that.
I can Vanna White it.
This is an appliance from a company called Somnodent. They were one of the early players in the game. They're an Australian company. It's a really nice appliance, very elegant, and works quite well. The fact is that all of them work well. So how do you know? Okay, well, there's certain factors that you need to take into account, and I think the easiest way to start, and the most important way to start, is to look at the characteristics of your patient and their health history. I get calls from clients, okay, I've got this patient, I need to make an appliance, which lab should I use, what appliance should I make? And the first thing that I want to know is, I want a copy of the sleep study, and I want a copy of the medical history for that particular patient. For example, if you've got a very elderly patient with very spidery handwriting, you know right off the bat that manual dexterity is an issue, and maybe an oral appliance might be difficult for that patient, and unless they have a caretaker to help them with it. So maybe that's a patient that you want to steer clear of. On the other hand, if you've got a patient who's who's obese, who has a high BMI, severe non-positional sleep apnea, tried CPAP, has failed it, then you know that you need to have an appliance that gives you an unlimited advancement capability. Nikki, I'm just going to stop for a minute. Did that go off?
No, I think we're still recording.
Okay.
Yep.
All right.
Absolutely.
Okay. Okay, so back to my train of thought. So for a severe patient, you're going to want to advance the device possibly 100%. Remember, these devices are dose dependent, so that might then lead you to making another choice, okay? Getting back to the age of the patient, and you also want to look at medications. More elderly patients, which are typically more prone to sleep apnea. It's like this, which is again the UCLA modified herpes, and even though the side mechanism that advances the mandible is rounded and smooth, even that could be enough to irritate her tissues, and she may not be able to tolerate that. Another thing to consider is that if you are using an appliance that has a connection like this, in order to work this appliance, the whole thing has to be fitted into the mouth at once, and the teeth worked into to fit into the appliance. And again, a more elderly person may have difficulty with something like that, so you may want to consider something like a TAP appliance, a Thornton anterior positioning appliance, where you can put in each mechanism separately, and also 300s all the way up to over $700 for some of the more high-end premium of durability. Have a less of a footprint, also don't hold up very well. So there's this trade-off that one has to make. Another consideration is Medicare. I encourage all dentists who are providing this service to become a Medicare supplier. You are not a Medicare provider for your dental practice. What you are is a durable medical equipment supplier, and therefore you're able to bill Medicare for the devices, and you're going to have quite a few of your patients coming in who are Medicare. The doctors who are referring to you are also accepting Medicare, and so it would behoove you to do that as well. Now, so back to Medicare. The Medicare appliances that are approved would be this particularly partial to devices that don't have a physical use, because they have what you can see here as dorsal fins. Now, I mentioned this particular lab, which is Somnodent, and they make, bear in mind what the size of the patient's tongue is. If you've got a patient with a high tongue position, very crowded oral cavity, then you want to maybe consider an appliance. There are many companies that make nice ones, and I happen to like the one from Somnodent because it's got good retention properties and a very nice series of appliances. One of the reasons I like ProSomnodent now that I'm showing you right here has got to be getting close to 10 years old, and you can see how the acrylic has yellowed. And we all know that acrylics do absorb color changes over time. The advantage of polymethyl methacrylate is that it is milled from an industrially produced block of acrylic, and therefore there's no free monomer. And I'm seeing these appliances come back in, and even for patients who don't really take good care of them and let them get stained up and get deposits on them, we clean them up in a jiffy, and they're just sparkling crystal clear, just like we started. So, I hope that gives you a fairly good idea of what kind of appliances that you want to make. Now, again, we talked about having appliances that gave us maximum protrusion, and that's another reason why I like the ProSomnus appliance, because their series allows for unlimited protrusion. And another factor that I think you also have to take into account is, we're entering a digital age of dentistry. Many of our procedures that we used to do in our practice, particularly taking analog type impressions using polyvinyl impression materials are a thing of the past. We've been using iTero for many years. There are other really good scanners out there on the market, and and laboratories that will support and accept these STL files. And so now you've got the capacity to scan the arches, do your bite registrations, and transmit the whole thing electronically. So you want to have a laboratory that's also able to accept that without you having to jump through a lot of hoops and downloading files and emailing, etc., in order or having your own models milled. So these are other factors to consider. And some of the newer laboratories like ProSomnus and even the older laboratories, I know that Somnodent has really gotten on board with digital. I can tell you that in one of our local labs in Chatsworth, Space Maintainers, they're also highly digital. A laboratory in San Diego called True Function. There's a good laboratory also on the East Coast in Brooklyn called Respire Medical. A lot of people like to use Great Lakes. They're also a good choice. So there are just many choices out there. So let's recap a little bit before we sign off today. So what are we looking for? Well, we're looking for what problem are we trying to solve? Is it primary snoring with a mild, very mild AHI, or maybe no measurable sleep apnea with an AHI of under 5? Well, an appliance that's fairly simple, that has a thin footprint, that'll do the trick, and you don't have to worry too much about protruding much beyond 50 to 70%. Whereas you have a more severe case, now you want to be able to have the capacity for unlimited advancement, and that might then drive you to select an appliance like ProSomnus, because one of the issues that I've had from time to time is that you end up running out of real estate, and that means that you've gotten to the limit of the protrusive ability of your appliance. Remember, we always want to be sticking with adjustable appliances because we just never know exactly where that sweet spot is going to be. Age of the patient and medications are a consideration, particularly with dry friable mucosa and not having things in the cheek areas that are going to cause irritations. Those are some considerations. Talked about cost. Cost of the material is an issue, and materials that devices that are on the low end that might be down under $300 may not hold up as well as you want, or if they are going to hold up, they might be bulky, or the workmanship is an issue. And I forgot to touch on workmanship. The quality of the lab really matters, but what matters more is your ability to produce excellent records, i.e. impressions and bite registrations, because it all starts with that. You want to be able to have these appliances delivered not by you, you want it delivered by team. And the last thing, doctors, you want is to have a big case you might be working on and be interrupted because there's a fit problem, and typically, or sometimes just the laboratory quality. In fact, I sent an appliance back just last week. We had nice digital impressions. The appliance was rocking, and sure enough, it was rocking on the model. Now, I won't mention the lab, but their quality control needs to be checked on. So I think we've talked about that enough. I'm reachable. You can check out my website, drgreenman.com. That's a good way to get a hold of me. Nicole, I think she'll give you some contact information.
Absolutely.
But we do really want to help mentor dentists and their teams. I work with the dentists primarily, although I also love to work with teams as well. Nicole works primarily with the teams, but she loves to work with the dentists. So we're somewhat cross-trained, but we have boundaries. And since I'm the clinician here, I'll be sticking with the clinical questions. So you can reach me the easiest way, drgreenman.com, drgreenman.com. Very simple. Look me up in Westlake Village, California. Nicole, why don't you tell how to get a hold of us?
Absolutely. One of the ways that we really like to support our clients, would you mind tapping on the screen just to make sure that that stays awake for me?
Okay.
One of the ways that we like to support our clients is by providing them with forms, really tried and true ways for your office to stay organized, to keep your records clean, and to help make decisions. And we do have a appliance selection spreadsheet that we share with our clients, and we'd love to share with any of you watching today. So the best way to get in touch if you would like a copy of the spreadsheet or to ask us any questions about DSM Solutions and how we can help is via email, info@dentalsleepapneatraining.com. You can find us at our website, dentalsleepapneatraining.com. You can reach us on Instagram at DSM Solutions CA. Find us on Facebook on our page, DSM Solutions, or just give us an old-fashioned call, 818-561-6715. So with that, we are going to sign off for our August episode of Add Water and Stir. We hope that this was helpful and informational, and we will see you in September. What do you think we should do? I put you on the spot.
Oh, well, thank you. Well, well, we've talked about some of the basics. We've talked about how to develop a dental sleep medicine practice.
Why don't we do a role play on talking to a new patient, bringing up sleep apnea, asking critical questions of your
Okay.
patients? I think that would be a great help to some of our viewers.
Okay, that sounds like a good one. Okay.
Awesome.
All
All right, we'll see you in September for this very exciting role play.
Okay, all right.
Cheers.
Cheers.